So I'm doing my EJV cannulation OSCE today. So first thing I want to make sure I've got is my PPE on, so I have my gloves and my goggles. Next, I want to get some consent from my patient. If they were conscious, I'd ask if they're cool with this. Otherwise, if they're unconscious, it's obviously for the good of the patient. Also, a way to expose the jugular vein would be to, if the patient was conscious, turn its head on a 45-degree angle and ask the patient to bear down like that. And that should expose the vein, or otherwise you can get them to blow on a syringe and try and get them to push the plug out. That should also just build the pressure up. If they're unconscious, you can expose the vein by just putting a bit of tamponade subclavicularly on the vein here, and you should see that distend somewhat. Otherwise, as a last resort, you can also apply pressure to the liver down here. Next thing I want to do is I want to make sure I have all my equipment. So I've got an alcohol swab, I've got a 5ml syringe and sodium chloride to attach to the back of my catheter. I do have a catheter which is 20 gauge, however best practice would be 14 gauge, and that's what I'd use in real life. I've got a lure, I've got some gauze for bleeding, a tegaderm to apply after, a saline to flush, and my sharps container. So first I want to set up all my equipment. So first thing, I'll get Mackenzie to drug check this for me, please. Could you just double check that?
Cool. This is sodium chloride 0.9%. It's 10 mils and it expires in June 2020.
Perfect. Yep, just triple check that. That seems right. So I just want to chuck 3 mils of sodium chloride in my syringe. Pull that out. Get rid of the bubbles. Nice, and I'm going to put them back in the wrappers just to ensure that they remain sterile. Make sure that's open. Tegaderm out. Put this down there. Got my saline and my polyflush open. Open my lure. So that is good to go. And finally do my catheter. We use these special catheters and attach the saline to the back of it just to minimize the risk of the patient getting a pneumothorax or like an air or plastic emboli. So that is why we do that. I put that back in the wrapper there, perfect. Next, I would just want to confirm placement of my site. And then I want to clean the site to make it sterile. So I'm just going to open this up. Figure out where I want to go in with my EJV, so around here. So I'm going to clean this in a circular motion from inside out, being sure not to rub bacteria back into the wound. So that is nice and clean. I'll just wait for it to dry for a bit. Now I'll get my needle and get ready to go. I'm going to go sharps out. Going to find my spot again. I'm going to tamponade on the vein, and with my thumb I'm just going to make it taut and provide a bit of traction. When inserting, I want to go in on a 15 to 20 degree angle, 2 to 3 centimeters. So I feel like I'm in. I'm just going to aspirate back just to see if I get flashback, which I do. Awesome. Now I want to flatten the needle so it's almost flat, and just insert another 3 mil. 1, 2, 3. Perfect. Now I just want to advance the catheter while keeping the syringe as stable as possible. So I'm going to use my thumb for this and just advance it in there. You can see that blood move out. Perfect. Now I just want to provide a bit more tamponade like that. Sharps out. I'm going to push that back, grab my lure, put that on there. Perfect. Now my next priority is to just secure the line, especially just because it's on the neck. You don't want the patient moving and popping it out. Now I'll get the rest of my tegaderm. Put it on like so. When putting the tegaderm on, you want to make sure that you can see the site of entry. There we go. Take that off. nice and tidy. Also just want to note down the time and date. So it is the 17th of 7, and I know it's 11 o'clock, 11 a.m. Right, so we can put that on for the nurses. Finally, just to confirm that the line is patent and clear, I just want to flush it out. I just want to go nice and slow. There we go, so that's moving really easily. That is good to go. Keep that clean. And that is my EJV OSCE.